Today it's time for The Doctor Is In. We're so happy to welcome Dr. Glenn Gallaspy with Azalea City Physicians for Women and Lorie Bush, who is the labor and delivery nurse at Spring Hill Medical Center. Thanks for being with us today.
Thanks for having us.
All right, so we've got some people watching online. So those of you who are watching and maybe you're pregnant or you're thinking about getting pregnant and you have any questions for Dr. Gallaspy, please go ahead and type them in the comments. We're going to be talking specifically about labor and delivery today, but I guess if you have any other women's health issues you want to ask Dr. Gallaspy, we can open up that door and ask your questions. We appreciate y'all coming in today. I mean, this is certainly an exciting topic for a lot of people who are getting ready to have a baby. And let's see if I can log on and see if we're getting any questions yet. Why don't we start with something we started with on News 5 at noon, and that's an epidural. So do most patients want an epidural?
Most people choose one, for sure.
And then you have those who are determined to stick it out and...
Yeah, and that's great. If that's how they want to experience their labor and delivery, that's fine with us.
There's a lot of people who say, well, I'm not getting an epidural because I don't think it's safe for the baby.
That's just a misconception. Okay. Epidurals are very safe. It's the ideal anesthesia for delivering a baby because the medicine doesn't go into the mother's bloodstream or the baby's bloodstream, and there's no sedation to mom or baby. So mom can be totally alert and enjoy her experience, and there's no negative effects on the baby.
And so if someone doesn't want an epidural, but they want some type of pain relief, at that point, what do you do?
Well, I mean, we have IV medications, but I think that kind of defeats the purpose since that does go in the bloodstream and can sedate the mom and the baby. There's relaxation techniques. We have birthing balls.
Do a lot of people use the birthing balls? You see the videos out there, and it's like a big kind of yoga ball.
Some patients bring their own yoga balls with them. We have what's called a peanut ball at Spring Hill. It's shaped like a peanut, and we provide those for patients that want to use that. A lot of patients that are wanting to go natural, they'll get up and just kind of walk around the room. Sometimes they'll walk in the hallway, but we try to stay on the monitor because we're in the hospital. So when we're on the monitor, they can get up and use the peanut ball to help relax on.
This person wants to know, at what age is a woman's pregnancy considered high risk?
We call advanced maternal age after the age of 35, and so that's a more high-risk pregnancy. You're at risk for certain conditions, especially towards the end of pregnancy, like preeclampsia, fetal growth restriction, things like that. Okay,
so over the age of 35. This person, Melissa, says, the more children you have, does this increase your chance of being high risk? And then what are your chances of developing diabetes?
Chance of developing diabetes during pregnancy?
I guess so.
Is it elevated in women that are older, are you asking? Or
yeah,
just
I don't know.
general?
I guess she's just wondering, you know, if the more children she has, does that make her pregnancy high risk go up?
Not necessarily.
Okay. So you can have many children and be, as long as you're, you know, under the age of 35, you're not considered high risk.
Correct.
Okay. All right, let's see. This Chelsea says, this will be my 4th cesarean and I'm worried about complications. How would you advise that I quell my fears?
Well, I think there's also a misconception that you can only have a certain limited number of C-sections. In training, I've done someone's 13th C-section.
Whoa!
And so you can have several, but there is usually more scar tissue, and it's just going to take a little longer. We're going to be a little more careful. Sometimes, due to that, having several previous surgeries and scar tissue, it can become more complicated. But I would rest easy. And trust your doctor.
Yes, and somebody is saying here, Misty Adams, Dr. Gallaspy is amazing, delivered both of my girls.
Oh, good.
Best
hey,
care
Misty.
ever.
Hey, Misty.
And so let's see, Jordan Lyle wants to know, when you have your first child, how long should you wait to have another one physically? How long does it take for your body to heal?
There's varying recommendations on that, but usually 13 months between pregnancies is kind of a general rule.
Okay, because you hear about Irish twins.
Right.
And so that's 13 months between pregnancies.
That's kind of a rule of thumb. It's not a hard fast rule.
No, hard fast. But yeah, because you hear a lot of people have a baby and then, you know, a few months later they're having another one. And
that's okay.
Kids, yeah, you can still have a healthy baby even if something like that
Exactly.
happens. Okay, let's see. This is an interesting question. Sabrina Taylor, if you have had your tubes tied and then you have a reversal done, what are the chances of getting pregnant?
It depends, but oftentimes, even if only about 50-50 chance usually. I don't want you to quote me on that percentage, but on average, that you're going to be able to get pregnant after your tubes are tied and reversed. But a lot of times, the majority of those pregnancies that occur, it's an ectopic pregnancy that gets stuck in the scar tissue. So that's kind of something that is not as recommended anymore, and a lot of people choose to go on straight to IVF when they've had their tubes tied before.
I see.
But some people still offer tubal reversal.
At what stage in pregnancy will the baby flip from breech to head down, and when should you be concerned about the baby being breech?
Well, usually that happens around 28 weeks. It could happen at any time, but usually after that, they're to head down to stay. But I've seen babies flip at the very last day, before they went into the hospital. We thought they were going in for a breech delivery, and we always put the ultrasound on right before we get started, and sure enough, that baby had flipped.
Wow.
So we start to get concerned, though, around 35, 36 weeks, because we can offer an external version to help turn the baby to head down prior.
Oh, okay, so you don't necessarily have to do a C-section?
Not necessarily.
You might be able to turn that baby around.
Sometimes, in the appropriate patient.
Okay, all right. And Jared Allen is saying, deciding to go to labor and delivery, base my decision on consistency of contractions or the pain of contractions?
Both come into play. Do you want to talk about it?
No. Consistency for sure, I think, as a nurse. Pain is so relative to that person. Some people have pain their whole pregnancy, so that's a hard call. When we're teaching patients, we tell patients, do you want them consistently for 2 hours?
Yeah, I usually give people a rule of thumb, contractions every 5 minutes for an hour straight.
Okay.
And you'll know when it's a contraction. There won't be any guessing anymore.
No, I agree.
That's what everybody was talking about.
That's what everybody's talking about, that pain. And we were talking about teaching patients. We do want to mention that you have a lot of childbirth classes available for people. We
do. We offer breastfeeding classes. We don't do one big childbirth class that lasts 4 weeks anymore. We've broken them up so you can come for just what you need, because if it's your second or third baby, you might need just some breastfeeding refreshers. And so we offer breastfeeding classes at Spring Hill, also at Babies R Us. We offer newborn classes and infant CPR at Spring Hill and Babies R Us. And then we do have an advanced childbirth class that's accelerated, that we do on a Saturday that just lasts half the day for all of your needs like that.
And one thing at Spring Hill Medical Center you were explaining to me, it's an interesting concept now, and you see more hospitals moving in this direction where everything is done in the same room. You have your baby and you just stay there. I mean, that's your room. Can you talk about that a little bit more?
I'd be happy to. That's a concept called labor, delivery, recovery, LDRP, postpartum. And the idea is to be family-centered and to have everything done in the same place so moms and families don't miss a thing. And your baby gets to be with you and maximize bonding. And so that's what we try to do at Spring Hill, and Casey Wallace did a great job with that design, and to make it feel modern and like a boutique hotel. There's valet parking, you are assigned to you check into a room, you have room service where your meals are delivered anytime you want. You just pick up the phone. They have bedside delivery of your medications from the pharmacy when you're ready to check out. We give the parents a meal when they go home. They have deluxe bathrooms with, en suite. So
sounds like a good
it's
place
really,
to go. Sounds
really
like a little
nice.
vacation
Exactly.
spot.
I try to make it seem that way.
Well, you want to pamper the mother while she's there for sure.
Right.
And make it comfortable for the families.
And just really promote that bonding and family experience.
You talk about family experience, and we were kind of joking before we got to Facebook Live about how a lot of people want a lot of family members in labor and delivery. And there's no specific number on, how many people can come in when you're delivering.
From our standpoint, we don't have a specific rule at Spring Hill about how many you can have in delivery. But every doctor is a little different, so you want to talk to your doctor about that, because some don't want as many people in there with you. But we don't have any problem with any number of patients in a natural delivery. In our C-sections, we prefer one person. Occasionally we'll let two, because that's more of an anesthesia's decision than ours.
Right. A little more room to take care of mom at the time.
Right. Okay. All right. Let's see here. If the expectant mother had preeclampsia with her first child at 19, what are the odds with the second at 21?
They're increased a little bit if you've had preeclampsia before.
Okay.
But it's funny, preeclampsia tends to happen more often in a first pregnancy than in a subsequent pregnancy.
Oh, interesting.
But when you compare it to other people who didn't have preeclampsia with their first delivery, there is a little bit increased risk of having it with your second.
Is Prozac safe during pregnancy?
That's a debate. I just recommend you don't take any medicines unless you absolutely need them, especially in the first trimester when organs are forming. Obviously, that you can take Prozac in pregnancy. I guess you just need to decide if the risks outweigh the benefit, and that's a patient decision when they've been, you know, given those risks by their doctor.
Right, right. So just talk to your doctor about that one. Let's see. How dangerous for the baby is it that a woman is under high levels of stress during the first trimester?
I don't think it's going to make that big of a difference.
Yeah, because you can't really control a
That's
lot of
right.
stress. So just
That's
try
right.
to deal with the best you can.
Exactly.
Right. Let's see. I have, Amanda Smith says, I have had 2 miscarriages over time. I'm about to be 31, and I have 2 girls. If I want to have another one now, what are the chances that I will have another miscarriage?
Okay. Well, the chance of miscarriage is about 1 in 3 pregnancies, and so it sounds like you've had two miscarriages, but 2 normal deliveries, so you're not outside the statistical norm. I don't think that's any different than anywhere else, you know, on the planet. And she's not going to be at an increased risk. It's going to remain that 1 in 3 ratio. Now, once you're past 40, that increases closer to 1 in 2.
Okay. This person says, Mary Schwartz, can you have a natural birth after a C-section?
You can.
Is that pretty common? I hear about, they call it, I guess, a VBAC.
They do.
Is that common? I mean, what do you like to do that, or you prefer that, or is that?
I don't think it's recommended after every cesarean section. You have to consider why the reasons you had the C-section the first time around.
Okay.
And there are people that are more appropriate candidates than others, and you need to discuss that with your doctor.
Okay. Okay, so you just discussed that one as well. Let's see.
I think one other important thing to know about that is if it doesn't go well, it can be catastrophic for the baby. So you need to consider that. Even though the risks are low, when it doesn't go well, it can go very badly.
Right. So do you find yourself recommending the C-section more often than not because of that risk?
Typically.
Okay. And Melissa Moore is asking about risks associated with an underweight woman who becomes pregnant. How much weight should be gained if you are underweight?
I guess it depends on how much you weigh, but on average I would expect a below average weight woman to gain around 30 to 40 pounds during her delivery.
Okay. Can you deliver a breech baby naturally?
You can,
Not on purpose.
but you try not to. It's a very risky delivery.
Okay.
The baby can get stuck and not get oxygen, and it's a very dangerous situation. There are certain times where that happens, and we're trained to do that in a pinch, but I would not recommend that.
Right. I mean, does that happen in a pinch? I mean, if you had to...
You hope not.
Yeah, I was going to say, because you said you take out the ultrasound. This would be a situation, I guess, where a woman came in, she's at active labor, and this baby's coming, and there was just no time to even...
Right. That's the situations where we typically do it. Occasionally, if a woman has had twins and the first baby was born head down, you can deliver the second twin breech because everything's already dilated. But even then, it's very risky.
Yeah. Okay. Is it really safe to drink wine while pregnant?
I don't believe there's any safe level of alcohol during pregnancy, and I think that's the recommendation is no safe level. No
safe level, because you hear about women, oh, I'll have a glass or 2. My mother had a glass or 2, but you know, I always felt like, no, this is right now that mother is living for that baby.
That's right.
And just put it up for 9 months.
That's what I say too.
Okay, let's see here. Finding out that you have a B strep in one pregnancy, do you recommend a second pregnancy?
A group beta strep? Is that what we're talking about?
It just says a B strep. I don't know what that is.
That's just a bacteria that lives on our skin from time to time, just like yeast or any other bacteria. I would certainly not not have a pregnancy due to that.
Okay.
We check every pregnancy for that, and just all you do get is antibiotics at the time of labor. It's easy.
Oh, okay, okay. Then this is something you touched on a little bit already. Are antidepressants safe during pregnancy for anxiety? Is it especially important with a history of postpartum depression?
Well, if your depression is postpartum, you don't need the medicine during delivery. I mean, during pregnancy.
Okay.
You can wait and determine that
After.
after delivery. And just because you had postpartum depression the first delivery doesn't mean you're going to have it the next time. But we are going to be more attentive to that patient and looking for those signs, which is a very common condition. Again, I don't recommend taking any medicines unnecessarily during pregnancy, or especially the first trimester during organ formation. But you can take certain antidepressants, and the risks just have to outweigh the benefits. If you can't care for yourself, or you're harm to yourself or others, then obviously that's the kind of patient that's going to need antidepressants, and we'll take them. But if otherwise, I'd try and use more natural stress reduction methods.
Okay, and this is an interesting question. Can you have a birth photographer in the delivery room?
Yes, we have patients that have photographers all the time in their deliveries. We have a hospital photographer that actually will come into your delivery too. The normal newborn pictures they take after delivery, they've gotten so much better than what they used to be. And our photographer for Spring Hill, We Edition, she will come to your delivery and take pictures. You just have to make arrangements with her beforehand.
Okay.
But then other people will bring their own photographer with them, and we allow them in there as long as they stay out of the way of the physician whenever we're in the middle of procedures and stuff.
Okay, is there anything you guys would like to say on Facebook Live to anybody watching out there that we haven't covered or that we haven't touched on that we think that people need to know?
I can't think of anything. Anything you think of? Can you think of?
Yeah, we've gotten to so many different topics. Certainly a lot of compliments coming in for you, Dr. Gallaspy.
Oh, thank you.
And your other fellow physicians with Azalea City Physicians for Women. So keep up the good work.
Thank you very much.
You.
Thanks for having us.
All right. Thanks so much, Lorie Bush, who is the
you.
labor and delivery nurse for Spring Hill Medical Center. Dr. Glenn Gallaspy, we appreciate your time this afternoon. And if they have any follow-up questions, if you're watching and you think you have a question for Dr. Gallaspy or for Lorie, is that okay if they give your office a call?
Love it.
Absolutely. And the Birthing Suites has a Facebook page. They can always go to it's the Birthing Suites at Spring Hill on Facebook, and they can always go there and like our page and ask questions. We try to answer them pretty quickly. There's 3 of us that watch it.
Okay, wonderful. Thanks so much. We appreciate it.
You're welcome.
And thanks for all of you for watching. The Doctor is in here on Facebook Live. I'm Devin Walsh. Have a great afternoon, and I'll see you on News 5 at 5 o'clock. Bye, everybody.